Good.
The title of the study is Breastfeeding Problems and Factors Leading to Early Weaning During Exclusive Breastfeeding Period Among Mothers of Infants. As you all know, breastfeeding is the primary way of providing ideal food for healthy growth and survival of infants. And WHO recommends exclusive breastfeeding for a period of 6 months and supplemental breastfeeding for at least 2 years. The absence of exclusive breastfeeding or early weaning with the introduction of other types of food before the age of 6 months have harmful consequences for the infant's health, such as early exposure to infectious agents, contact with foreign proteins, and damage to digestion process. And mothers are likely to come across various difficulties and problems during exclusive breastfeeding period, and it is important to know why mothers resort to give feed other than their own milk during this period. So there were 2 comparative studies in Belgium regions on reasons for early weaning, perceived insufficient breast milk, and maternal dissatisfaction that showed that social demographic characteristics of population influence the rate of exclusive breastfeeding. And another study, a community-based study at Institute Palakkad, Kerala, India, on mothers' awareness, attitudes, and practices related to exclusive breastfeeding for first 6 months of infancy showed that advice from family members and insufficient breast milk were the major reasons for non-exclusive breastfeeding. So the objectives of the study were to estimate the proportion of breastfeeding problems of mothers during exclusive breastfeeding, to determine the factors of early weaning among mothers of infants, to determine the association of breastfeeding problems with socio-demographic characteristics of mothers of infants and birth characteristics of infants, to determine the association between breastfeeding problems and factors of early weaning. So the assumptions of the study were maternal knowledge and education can influence breastfeeding practices. Breastfeeding awareness programs can bring about positive change in breastfeeding behavior of mothers, and information of breastfeeding problems will give better insight for policymakers and healthcare professionals. So coming to the operational definitions, breastfeeding problems in the study refers to the problems that arise related to breastfeeding of an infant, which are classified into intrinsic breastfeeding problems and extrinsic breastfeeding problems, assessed by a structured interview schedule on breastfeeding problems among mothers. And early weaning is a stage where complementary feeding is started before the completion of exclusive breastfeeding period, that is first 6 months of baby's life. Then exclusive breastfeeding is the intake of breast milk without any additional liquids or solids, but intake of oral rehydration solution, vitamins, minerals, or medications in the form of drops or syrup are allowed. The research approach was quantitative approach. Descriptive analytic design was used for the study, and the setting was pediatric wards and OPDs of selected tertiary care hospital, Ernakulam district, Kerala, India, and the population, mothers of infants in Ernakulam district, Kerala. Then the research variables were outcome variables, breastfeeding problems, and factors of early weaning. The external variables were socio-demographic characteristics such as age, education, occupation, place of residence, type of family, parity, number of living children, and income. The birth characteristics of infants were birth weight, mode of delivery, maturity of baby, and birth anomalies. The sample and sample size were 75 mothers of infants attending pediatric wards and OPDs of selected tertiary care hospital Ernakulam was there. And sampling technique was sample of convenience. For the sample size calculation, the following equation was used, and the sample size was equated to 75. The sampling inclusion criteria was all mothers of infants attending pediatric OPD or wards of selected tertiary care hospital was used. Were there all mothers of infants who can understand Malayalam and English were included. And the tools and techniques were tool 1, demographic data sheet, that included section A, the socio-demographic proforma of mothers, and section B, birth characteristics of infants. Then tool 2, structured interview schedule. Section A consisted of breastfeeding problems of mothers of infants, and section B, factors of early weaning among mothers. And the content validity index of these two tools were 1. Then ethical considerations, ethical permission was obtained from Institutional Ethics Committee of Selected Tertiary Care Hospital. Permission was obtained from hospital authorities. Informed consent was obtained from the subjects, and confidentiality and anonymity were ensured. A pilot study was conducted. After training the interviewers, data were collected using structured interview schedule to know the feasibility of study among mothers. The time taken for the interview was approximately 20 to 30 minutes. Questions were very clear to mothers. Study was found feasible and there was no methodological issues. Then the data collection methods were IEC approval was obtained, approval from hospital authority was obtained, consent from HODs and study subjects were obtained. Each mother was interviewed using structured interview schedule. 20 to 30 minutes were taken to collect the data from each of the mothers, and filled up forms were verified for completeness. Then data analysis, the collected data was entered into Excel sheet which was pre-coded. Our software was used for the analysis, and the level of significance was set as P less than 0.05. Breastfeeding problems were estimated in proportions. Frequency and percentage was used to report factors of early weaning. To determine the association between breastfeeding problems and socio-demographic characteristics of mothers of infants and birth characteristics of infants, chi-square test or Fisher's exact test was done based on the normality of the data, and mothers were classified into 3 categories based on severity of breastfeeding problems. So here is the categorization of mothers according to the scores obtained on severity of problems. They have mild, moderate, and severe in intrinsic breastfeeding problems, and the categorization was followed for extrinsic breastfeeding problems. Then coming to the results, you can see from the table that 53.33% were from 26 to 30 years of age, and 62.7% had graduation, and 53.33% were homemakers, and 45.3% had more than 45,000 income per month, and 46.7% were Christians, 56% were from rural area, 69% were from nuclear family, and 52% had first parity. 49% had one living child, and 97% were aware of WHO recommendation of breastfeeding, and 60% had normal delivery, and 52% breastfed their child within 1 hour. 98%, 99% gave colostrum, and 42% had breastfeeding problems, and 38.7% of the mothers started weaning. Regarding the birth characteristics, 44% of the infants had birth weight of 2.5 to 3 kilograms, and 60% had normal delivery, 82% had full term maturity, and 92% had no birth anomalies, and only 9% had any infection during birth. So you can see when the frequency and percentage of mothers according to the severity of intrinsic breastfeeding problems, you can see 57.33% of the mothers had only mild intrinsic breastfeeding problems, while 30% had moderate breastfeeding problems, and 12% had severe intrinsic breastfeeding problems. Whereas 97% of the mothers had only mild extrinsic breastfeeding problems, and 2% had only moderate. None of them had severe extrinsic breastfeeding problems. When the causes were analyzed based on the report of the mothers, it showed that if 24% reported that child felt happy after complementary feed, 62% reported that they had inadequate milk, and 20% were working mothers. 27% started breastfeeding based on health professionals' advice. 48% started weaning based on family members' advice, and 10% had other reasons. You can see when the association was tested, None of the variables like age of the mother, education, occupation, income, family, parity, and mode of delivery, birth weight of the baby, maturity of the baby, birth anomalies, any infection of the infant had no association. But when the factors of early weaning and the breastfeeding problem, when the association was tested between breastfeeding problems and factors of early weaning, it was tested significant. So when coming to the discussion of the study finding, in the present study showed that the common breastfeeding problems were perceived insufficient milk, not having enough milk, child sleeping at the breast, and child wanted to be breastfed all the time. So a supporting study, that is survey done by Robert et al. In 2014 in Belgium, also got similar results. But a contradictory study, that is a mixed method study by Fenistrom et al. In Denmark in 2018, found that most prominent problem were infant inability to latch on and mothers having sore, wounded, and cracked nipples. So methods of data collection were different in these studies. Content analysis was used to analyze mothers' open text descriptions of their most challenging breastfeeding problem. Second, common factors of early weaning were inadequate milk, family members' advice, health professionals' advice, child felt happy after complementary feeding in the present study. But a study done in Josmita Maria also had similar results. But study done by Rice in Spain in 2013 found that factors associated with early discontinuation of breastfeeding were pregnancy-induced assisted reproduction method and maternal smoking. The variables were collected performing a structured program of surveys to the mothers. Again, in the present study, no socio-demographic characteristics of mothers and birth characteristics of infants are significantly associated with breastfeeding problems. Same results were supported by Mangrio et al. In 2018. But a study by Ona in Nigeria in 2014 found that factors such as low maternal education, higher socioeconomic status, non-vaginal birth, use of prelactal feeds were significant predictors of lower, exclusive breastfeeding practice. So data on breastfeeding were based on infant breastfeeding practices in previous 24 hours in contradictory study. In the present study, there is significant association between breastfeeding problems and factors of early weaning, but no studies were obtained supporting this study or any contradictory study. So the implications of the study are in nursing practice. Nursing professionals in the postnatal ward should demonstrate adequate knowledge of breastfeeding problems and factors of early weaning in exclusive breastfeeding period. And they should educate the mothers on breastfeeding policies and help them to initiate breastfeeding. The students should be empowered to conduct breastfeeding clinics, mother and baby clinics in community and hospital to assess the breastfeeding problems and to improve the rate of exclusive breastfeeding during early 6 months. Then the nurse administrators should implement policies for the better implementation of breastfeeding guidelines and teaching sessions for the clinical postnatal nurses. So the present study can pave the way for further research and the discovery of interventions in the area of problems faced by the mothers in the exclusive breastfeeding period and about the factors of early weaning. So the recommendations are preventive precautions related to breastfeeding problems experienced frequently by mothers should be taken, and individual solution method related to these problems should be developed. Healthcare managers should establish institutional policies to reduce breastfeeding problems, improve solution recommendation, and extend the scope of service they give. So to summarize the study, the proportion of breastfeeding problems were intrinsic breastfeeding problems, which was nearly 43%, and extrinsic breastfeeding problems were nearly 3%. The common reason reported for early weaning was inadequate milk. There was no statistically significant association between breastfeeding problems and socio-demographic characteristics of mother or birth characteristics of infants. There was significant association between breastfeeding problems and factors of early weaning. So to conclude the study, the nurse's role in supportive breastfeeding varies with time and place where patient care is provided. The postpartum nurse can help breastfeeding to continue by providing frequent maternal infant contact during the mother's hospital stay. The nursery nurse can support breastfeeding by refraining from giving baby other fluids, and the pediatric nurse continues to help the pattern by reinforcing the statements and actions of others, which will further impress the mother with the appropriateness of her infant feeding method. So the nurse plays a significant role in helping the mother to begin breastfeeding and to enjoy it, at the same time providing her infant with optimal nutrition for his or her early growth and development. So these are my references. Thank you very much.